Angela was one of the select students who accepted a position at Queen's for medical school directly from high school. There are 10 positions in Canada, and I guess it's 3 years ago now you accepted that position. Is that correct? Yes. We were very fortunate to have Angela come and work with us on 2 different higher med student grants. And Angela, prior to that in high school, managed to submit over 3,500 hours of volunteerism at her local hospital. So, and I think she also worked part-time as well. So I'm not sure where you fit all this in, Angela. Angela is currently again in her 3rd year and has been a joy to work with and connect with on our projects. So I'm going to turn it over to you, Angela.
Awesome, thanks, Michelle. I'm just going to share my screen. I have some slides. There we go. And perfect. So, yeah, thank you for having me today. I'm really excited to speak about the work that I did just over a year and a half ago. So I helped work on some of the mental health resources available with Romp. So I'll just get started. Just some background. So like Michelle mentioned, I was part of the Key Arms program at Queen's. So for those who don't know, it's essentially a program that you accept out of high school in grade 12. And so I had the opportunity to do 2 years of undergrad before entering medical school. And so I'm now in my 2nd year of medical school, so pre-clerkship. And then prior to that, I did psychology for my undergrad. And then on my summers off, I worked at Romp for summer 2020 as well as summer 2021. And so I'm really excited to speak about some of the mental health work that I did over these summers. So essentially, I was tasked to update a pre-existing youth mental health resource, which was established a few years prior. But as I was going through the resource, I began to identify some areas of improvement beyond just updating some of the contact information. And so that led me to eventually create a whole new resource as well as an accompanying handout. And I also was able to do something similar for the adult mental health project. And so I'll just start by going over the original resource that I was tasked to update. And so this is what it looked like. And as you can see, it's very comprehensive. It has some headings to organize. There's contact information, and yeah, so this was really great work that was done, and it was definitely a good starting point. But I began to think of some ways that I could improve it, and so essentially some areas of improvement that I had identified primarily was that I wanted to improve the inclusion of resources for vulnerable populations. So this is something that I'm very passionate about. So I made it a priority to seek out resources that specifically support groups such as people of color, people with disabilities, Indigenous people, and members of the 2S LGBTQ+ community. And so I wanted to not only seek out resources for these populations, but highlight them in the guide. And then as I was collecting resources, I'm sure you saw on the previous one, there's quite a few. It can be kind of overwhelming. And so we decided that it would be beneficial to create like a consolidated version of the guide, which could be presented in the form of a handout or a brochure, something like that, something accessible. And then additionally, I wanted to improve the accessibility of the resource to optimize realize its utility. So one of the problems, or something that I thought could be improved from the original resource, was that it at times could be a bit difficult to navigate based on the way the resources were categorized. So some ideas that I had implemented to the new resource included symbols with a legend to highlight specific features of the resource, which I'll show you in a minute, as well as a table of contents to allow users to easily locate the specific heading that they need, and then ultimately revamping the headings to be more comprehensive and more specific. And so, yeah, and then additionally, I thought it was important to address the target audience of the resource. So not only did we want the resource to be accessible for those seeking support in the community, but it was also important to make it accessible for healthcare providers and physicians and those who may be referring their patients to use these resources. So for example, if someone is in a really high stress environment, like the emergency department, they might not have the time to look through a really long book or a really overwhelming guide. And so I wanted to make it accessible additionally because of that reason. And so ultimately this process took place over a few months, and it involved a lot of work and collaboration and reiteration. And so I just wanted to highlight all the collaboration that went into this. It certainly was a group effort. And I also received feedback from a lot of people. I wanted to make sure that there were many sets of eyes on it. So I had coworkers at Romp look at it. I met with a social worker, an emergency physician, and Dr. Juskis. Also, I met with her several times just to make sure that this was really the most comprehensive and best work that I could put out. And so ultimately, the Youth Mental Health Resource Guide, this is the revamped version that I created. And so as you can see in the table of contents, there's many different subheadings. So I wanted to make it specific rather than just saying a general like online resources. So as you can see, there's all the different categories there. And just to highlight on the bottom half there, you can see I included those resources for vulnerable populations such as immigrant, refugee support, Indigenous service, LGBTQ2S+ services, and more. And so this is just a sort of look into what the book looked like. And so there's a where to start, and then the second part there, with youth support, was just an example of one of the headings. And then as you can see, there's a legend. So I wanted to sort of have a way to easily identify some of these key features. So whether the service costs money, if it required referral, if it could be offered virtually, especially because this was in the midst of the COVID era, whether it would be available 24/7, and whether it was available in other languages. And then from there, like I mentioned, we had the idea to create a consolidated handout version. And so this is what it originally looked like. And so again, just sort of a consolidated version of what I had done, and then a QR code leading to the full version that I showed just before this. And so same idea, same headings and symbols and all that. So that was the Youth Mental Health Guide that I had done. And then eventually I was also tasked to sort of support the adult mental health care aspect. So this is the integrated care pathway for mental health services. And so a lot of this work had already been done before I came onto the project. So a lot of the resources had already been collected, but I just wanted to organize it to be accessible and sort of add to it where I saw it was necessary. So similarly, you can see I have the table of contents there. For this one, following discussion with some stakeholders, this was organized into 3 overarching headings, including mental illness, mental health health symptoms and mental wellness. And this was just done ultimately because, as we know, mental health isn't just the DSM definition of anxiety or depression. There's a lot of aspects to it, so we wanted to make sure that we included things like mental health symptoms like stress, or promoting wellness through resiliency, or addressing social determinants of health. And so that was the thought process behind that. And as you can see, this is, again, a really comprehensive, very long guidebook. And so here's just a little excerpt of some pages from the book. And so again, there's some symbols there. For this specific book, I organized the resources by the population we serve, severity based on the color rating, whether there's a cost associated, the access, so whether it's self-referral, physician referral, the service providers available at the resource, and then just a short little blurb about what services they offer, and then some kind of contact information. And then for the online version of this, I have hyperlinked to each one. So that's kind of what this one looked like. And then just some key takeaways from the whole process is ultimately it really does take a village, and Rome wasn't built in a day, and everything they say is true. This is a really long process, and it was a large undertaking, and it couldn't have been done without the efforts of everyone that contributed. And I also want to highlight that we have received funding from the Knowles family to work on this project, and ultimately couldn't have been done with all these people. And additionally, I wanted to highlight the importance of identifying gaps in care and providing support for vulnerable populations. Like I said, this is something that I'm really passionate about. And personally, as the child of immigrants who require additional care when accessing healthcare resources, I can see firsthand the difference that accommodations and special care can make in improving health outcomes. So this is something that I continue to take with me into my future practice as a physician, and something that I think is really important to highlight. And then for future directions and kind of like where this project went, ultimately at the end of the summer, I went on to start medical school. So I didn't really get to see the completion of the project, but I know that the work was further developed. I think it went through some redesign since then, and I know that it's now available on handouts.ca, which I think was mentioned in the previous presentation. But this is just a platform which collects resources for patients in the easy to access. So I know that's available there, and then the research is also made to be distributed to other areas other than just healthcare. So like, for example, the youth mental health resource would be an excellent addition to schools for teachers to be able to refer their students to, or other healthcare practitioners, GP offices, just to widen the impact of the resource. And then additionally, as I have updated the original youth mental health project, I know that my work should be continually updated as things evolve and resources change and more resources come up. So I think this is definitely an ongoing project, and I'm so glad that I was a part of it. And so that's all that I had for today to present, but I'm happy to take any questions or comments.
Does anyone have any questions for Angela? Great, thanks, Dr. Schmidt.
Great work, Angela. I'm very impressed, and as a physician who will at one point age out of the system, it's lovely to know that I'll be backfilled by people like you. I got a couple of questions, and actually one's for Romp. I think this would be an amazing project to scale throughout the entire province, and I'll tell you why. As a family doc who's been doing this for about 40 years, even working in London, Ontario, I didn't have a template to go to like this. And I think, busy physicians scramble for services all the time. And so to have something that is locally available and accurate, I think is a huge, it's a huge gift to those of us that are in the trenches working. You've created a template for success already. And I think, if that template could be scaled to all rural communities across the province that Romp and Knowles are involved with, I think that would be a huge, it's like you say, it's a huge project, but I think it'd be a very worthwhile project, especially because our mental health concerns in the province are not going to go away. In fact, they're probably going to escalate as the physician cohort starts to age out. And the other, I was trying to think of one other thing. Oh yeah, I was going to ask you on a personal note, what's the biggest challenge for somebody so young in medical school? And I'll give you the background on that. When I went to Western, I was the oldest person in the class, and the dean asked me if I would buddy up with the youngest person in the class that came out of first year undergrad. And so we did, and I found that, I think he found it more useful than I did. I did more work because he was chasing women and I was married. But it actually benefited both of us. And I think he turned out to be a cardiac surgeon and I went into medical or family practice. So, but I think he was so young. You are way mature beyond your years. Like you don't look, I'm not even gonna ask how old you are, but you look very young. But I think he really benefited from actually buddying up with older classmates. But he also took a bit of there were only 4 of them that it was a pilot project. And I think I don't want to say they were looked down upon, but they weren't taken seriously. And I don't know if you've experienced any of that.
Yeah, I would love to comment on that. So Queen's, I think, is known for being one of the more mature schools in the sense that we have a wide range of ages. So for example, I think my oldest classmate is over 40, and so it's really interesting. But I do love it. I think to myself, like, where else do I have the opportunity to befriend someone a decade older than me? And I learned so much from them. We have so many people from different backgrounds who worked in healthcare previously or had other careers, and they have so much wisdom to offer. And medicine is all about collaboration, so it's really great in that sense. In terms of challenges, I think one of my fears is that I wouldn't necessarily be taken as seriously. And since I haven't started clerkship, I haven't really faced that yet, but I can certainly see that coming my way, unfortunately. But I think I have hope, and I think that perhaps like making up for my age and knowledge and hard work and maturity will hopefully make up for that. But so far it's been great.
Thanks, Angela. Any other questions for Angela? Oh, I've got one more.
It's a very small question. I'm just wondering the guides that you've talked about and the lady before, are these on the hospital website? Where do we access these? I know there's one here. Handouts.ca. Okay, so this is on handouts.ca as well. Okay, so for me, this is beautiful. I think both of them are beautiful. I can't wait to bring this back to our organization. I'm a manager at Catholic Family Services. I think we're on here. Now the big piece is getting enough funding to be able to meet the request for services. It's great to have a place to go to, but we also need the funding. So anyway, but thank you. It's all very good.
And just Dr. Joskus.
Angela, I think you've done a phenomenal job with respect to putting all of the hard work that went before together in a very accessible package, and for that I'm very grateful to you. For the group, I would like to let the group know that there was an individual who actually called all of the resources and did a telephone interview with all of the organizations that have been listed to make sure that they met the needs that they said that they did. And that was a huge amount of work. So without that person, and then Angela really putting it together, it wouldn't have happened.
So as you can tell, there's been several iterations from when Angela started. And fortunately, we were able to launch this with a donor who had funded the initial project through the foundation. So I would encourage communities to look at that, even if it's the co-funding, to perhaps hire a medical student. So if we're talking about scale and spread, there is one thing that does happen for sure. Medical students and residents travel to every single corner of this province, and with them can go various projects that will improve quality of care, projects that will introduce new providers, as we heard actually yesterday from one of the deans. So there are different opportunities to mobilize information, and one of them can be looking at this same project being developed again in your site, in your community. So thank you, Dr. Schmitz, for mentioning that. And that is a way for this to do that. And we have started with a very small envelope of funds. Those funds then became available year after year, partnered together with the Canada Summer Jobs Grant. So in addition to that, the various projects that were applied for through the RED Grant and through the United Way, we had another opportunity to expand that further into residency training. So all of this can be enabled. We have models and platforms which you can use and submit, so you don't have to reinvent the wheel, and we can start this project again. But it's been lovely to have something kicked off with Angela, and then the various iterations that have come along, so that we have our Know and Be Still program, which is now a fully funded program each year, so that all of the to print or not to print, we leave it on handouts.ca. It becomes updated every single summer after one of the higher med student programs has reassessed and evaluated that. So we have to have a project of renewal, and we have to have an opportunity to mobilize something also to other communities. So I hope you will have found this very illuminating, and please see us for a student, or perhaps replicating another project that's in the works. And with that, we are going to break for lunch. Thank you so much again, Angela, and we'll see you soon.
Thank you.
Bye.